am Dr. N Reddy, physician practicing in Hyderabad for the last 40 years. Government of India is taking different measures to control different diseases. In order to highlight these diseases, we arrange programs on specific days for diabetes, for hypertension, for heart diseases, and for hepatitis also. So, 28th July is earmarked for Anti-Hepatitis Day. So, I am here to explain you the various modes of transmission, prevention, and treatment of hepatitis B. So, hepatitis means it is an inflammation of the liver. So, any inflammation in the way of viral infections or metabolic disorders or injuries or toxic metabolites or alcohol can injure liver. So, injury to liver is due to many reasons. Now we are talking about only viral hepatitis. Viral hepatitis is also preventable disease. So it is everyone's responsibility to take measures to prevent hepatitis B. There are 5 types of virus hepatitis B: A, B, C, D, and E. Viral hepatitis A is caused by drinking infectious water, unclean water, and contaminated food. So, it is very easy to control hepatitis A, which is very common in our area. That is by taking filtered water or boiled and cool water and taking safe food. Do not take food that is outside, open to the market, open to the weather, which is having many pollutants. So, hepatitis A is easily preventable. Hepatitis B is B and C are a bit dangerous, because hepatitis B, once you get infected with this virus, it is a lifelong infection. It will not go away. If your immunity is good, it will subside, it will stay in your liver cells, but it will not go away. When you become poor or when your immunodeficiency occurs, again it arises. So it is a very dangerous hepatitis B disease. It may lead finally to cirrhosis of liver or even hepatic liver cancer. So in order to prevent these complications, we have to be aware of its origin. So how it occurs? Mainly it occurs through contaminated needles. You should not allow any person to reuse a needle. You should not take injections which are utilized again. Or in the operation theaters also, the doctors take preventive measures in order to by using all disposable needles. And also it occurs through sexual contact. If any infected person is there with hepatitis B, if he does unprotected sex intercourse, then the partner may develop hepatitis B. So, proper sexual intercourse with precautions and surgical measures and avoiding contaminated needles are main important preventive measures for hepatitis B. In case hepatitis B it occurs to you unfortunately, then what measure you have to take to avoid further contamination? So you're not fit for blood transfusions. You should not give your blood to others for donation. Second thing, whenever you go to any lab or hospital, you should disclose that you are hepatitis B, so that the doctors take preventive measures in order to avoid their communication and communicable disease, and to other sisters also. So it can be cured, but it is a very prolonged procedure where you have to take medications for long time, and 50% of the patients will become hepatitis B negative on prolonged use. Hepatitis C is another disease which also occurs only among drug users, drug abusers, who take contaminated needles and exchange those needles with their partners for taking drugs. So that is also very dangerous, and that should, unfortunately, drugs are very less in our country, but it is progressing in major cities. So you should be careful that your children are not exposed to drugs and drug users with syringes. That you can avoid by hepatitis C. Hepatitis D, of course, only if you have hepatitis B, hepatitis D will survive in your blood. So if you take care of hepatitis B, hepatitis D also is taken care of. Hepatitis E is again through water and infected food. So if you take preventive measures for water and boiling water and proper food intake, hygienic food, hygienic measures, then you can prevent hepatitis E also. So the only culprit dangerous hepatitis is B and C. So by taking proper precautionary measures, you can prevent. In case, in children also, you can prevent hepatitis B by proper vaccination. The government of India is providing free vaccines in the hospitals, and it's available at very less rate in private sectors also. So I request all the children to be vaccinated against hepatitis B. That is very easy. One dose, again after booster dose also can be given in order to immune your system. So in this way, by preventing, by taking vaccinations, by properly maintaining hygienic measures, and by taking proper treatment, you can avoid complications of hepatocellular carcinoma or cirrhosis of liver, which are rare serious consequences of hepatitis B. So I hope you will follow all these instructions in preventive measures and also vaccinations, and avoid hepatitis B in your family and your children. Thank you.